Andrea, thank you so much for coming and speaking with me today. I was wondering if you wouldn't mind just introducing yourself, giving us a bit of background about your history with WM.
My name's Andrea Woodford and I was diagnosed with WM in November 2018. It was a random blood test for something else that I'd gone to see the doctor about, and it come up with some different things that they weren't too sure about, so I had to further blood tests. And it came from there that I went to see the doctor at the hospital and then went for a bone marrow biopsy, and that's when they confirmed that I had Waldenstrom's macroglobulinaemia. I had 2 years, I would say, 2 years and a little bit until I needed treatment. Mm-hmm. So treatment was in 2020, just before COVID. Yeah. So in that February, and so I started initially with treatment. I'd had BNR, so rituximab and bendamustine. Yeah. So I was due to have 6 treatments initially, 2 sort of consecutive days, but then because of COVID, they decided I'd only have 1 day. They didn't want me in the hospital too many times, just the danger of coming across somebody that maybe had COVID. So yeah, that's when I had it. And since then, that was June 2020, then that finished. And 3 years now, I've been really well. Yeah, my paraprotein levels are sort of non-quantitative, so, you know, there isn't any trace at the moment of WM.
Amazing. So obviously, you had your treatment, but before that you said you had 2 years where you had no treatment, so you're on active monitoring. And then I assume obviously you finished your treatment back in 2020 and now you're back on active monitoring and have been for around about 3 years. So you've experienced active monitoring for around 5 years, is that correct?
Yes, yeah.
And obviously when you were first diagnosed and went on active monitoring, how did the consultant sort of approach that conversation with you about active monitoring?
At the time when I was first diagnosed, I was in a bit of a way, really. I found it was all rather overwhelming, and it was sort of quite a quick conversation, and that, you know, he told me I wouldn't need treatment, but I don't think he actually used the words active monitoring. But then I went and saw the nurse, clinical nurse specialist, and she explained about it a lot more. And then I understood that I would be seeing him on a regular basis. And then we talked that through, really. Yeah.
And how did you initially feel when you said that you weren't necessarily going to have treatment straight away, instead they were going to place you on active monitoring? How did that kind of make you feel at that time?
I had mixed emotions, because I was like, oh, thank goodness I haven't got to have a chemotherapy or any other treatment at that time. But then on the other hand, you're just thinking, is the cancer going to get worse? And when would I need treatment, or would it be too late? Because I think you think of cancer as being a solid tumour, yeah, whereas blood cancer is very different, and it's treated very differently. So yeah, because usually you think, oh, just cut it out and I'll have treatment and everything will be fine. Whereas with WM, you're living with cancer, it's not going to go away. So yeah, it's understanding that, really.
Okay. And obviously, like we've mentioned, you experienced active monitoring before your treatment and then after. Do you think that you feel differently about active monitoring before and after treatment, or do you think it's quite similar?
I think it's different, because when I first started, there wasn't COVID, so I used to go into clinic, used to see him regularly, see my nurse specialist, and then following COVID, and during that time, that active monitoring was via the telephone. Yeah. And I was asked, do you want to go? You can come back to clinic if you want to, or we can carry on having telephone conversations. So I decided to have telephone conversations. But sometimes I think you lose something because you're not actually seeing that person and they're not seeing how you are physically, sort of mentally. Yeah. I think it's a quicker transaction, if you know what I mean. You know that he's very busy, and I do get ready, you know, have questions and things like that. But it's just taking the time. I think there's less time taken. But also, I'm feeling well, so that's different again to what it was, you know, before treatment. Yeah.
And obviously, you touched upon that, assessing you and how you're doing mentally as well. Obviously, we understand that active monitoring can have quite an impact on your mental health. How do you feel kind of emotionally around being on active monitoring and dealing with that pathway?
It's fine normally, but when you know an appointment's coming up about a week before, you start to get apprehensive and a bit anxious because you're always thinking, well, maybe this time they're going to say that the bloods are showing that WM is sort of coming back with gusto and that you might need treatment. So you do worry. And on that day, when you're, you know, when I talk to him, you get quite tired really by the end of that day because you're so anxious about it and you want things to go well. But by the time you've had that conversation, it's like, oh, thank God, you know, that you're okay. It's that relief really. But it's that build up is quite difficult.
Do you find that the management of your appointments and the expectations of your appointments get better as time goes on, or do you feel like it's still quite similar to when you were first diagnosed? You know, sort of understanding in terms of why they're treating you in this way, or not treating you, actively monitoring and sort of going down that route?
I think it's over time, because I, you know, have made use of WM UK. My knowledge has improved, and talking to different people with WM also has made a difference. So actually the questions I'm asking are more informed. So it is a different process in that way, because initially you're just like, you know, a rabbit in headlights really. You don't know quite what to ask or how to ask it. But over time it has got easier. I still prepare, I still have questions, I write everything down. And I, you know, and as he's talking to me, I'll write little notes as well so that I can look back and look, you know, and see later on. And when I'm talking to other people, I know what I can refer to. I just think you feel, because you have greater knowledge, you feel in greater control when you're having that active monitoring. Yeah.
And obviously you touched upon a few complications in terms of when COVID hit and how that changed your active monitoring. Have you had any other sort of complications or any challenges around active monitoring?
I think it is just that time. That's the thing that I find most challenging. You know, we all know in the NHS doctors are busy, so I don't want to take up more time, but there are things that I want to ask. So sometimes, because he knows I'm well, he wants to get on. It's not, you know, there's no fault in that, but it's just actually, no, can I bring you back? So that's the challenges I have. But my clinical nurse specialist is always available. If I ring her up on, you know, the same day, she'll go back to me. So I know that support network is there, and it's a really good support network for me.
Amazing. And if you could give sort of one piece of advice to other patients around active monitoring, is there anything that kind of comes to mind for you?
It's really easy to say don't worry, but try not to worry, and just be prepared, get all the information you can, so that when you have information, when you have an appointment, you can ask the right questions. Yeah, they're there for you. You know, it's really important that they understand that people are there for you all the time. There's always somebody you can talk to, whether it's somebody from the WM UK group or you've, you know, made friends with somebody that you can contact, but your nurse specialist is always there. And if they don't know the answer, they'll ask, well, in my case, if they don't know the answer, they'll ask a consultant and they'll get back to you.
And Andrea, if you could give healthcare professionals one piece of advice around active monitoring, what do you think that would be?
That would be to be really active in their listening. I think that's key. You know, to really listen to their patients and what is it that's troubling them, because sometimes the questions you ask, it might be other things that are underlying that. So it's really getting to the bottom of those symptoms that a patient may have.
Brilliant. And whilst whilst you're still on active monitoring, do you feel that you're still quite well supported? You know, obviously you've had treatment before and you're very much supported through that. Do you still feel supported on active monitoring?
Yes, definitely, yeah. I think that team, as I said, it's that network of people that you can count on. Yeah. So even though I think, like I said, that you feel like appointments are shorter in the fact that you are well, and obviously you've got less probably questions you want to ask, and he's got less to tell you. That they are there at all times.
Amazing. Thank you so much, Andrea. I really appreciate that.
Thank you.